His title is Chiropractic Sports Specialist, which is kind of a long-winded way of saying if you've got a nagging knee injury and you're willing to pay to get it fixed, Dr. Dale Macdonald is your guy. He runs the Knee Clinic, Alberta's only such private facility.
Diagnosis, the key is just having the clinical skill to know exactly what you're feeling and what you're seeing during the exam. All too often doctors rely on advanced imaging that costs the government a lot of money, like MRI, and very often you can do a clinical assessment that gives you the answer without the MRI. So we're trying to just filter out the ones that really need those advanced imaging versus the ones that don't.
And the sooner the better, I assume. Right?
Absolutely. The more that you hobble around on a knee, the more compensations your body's making, and the worse off you end up being. We see patients that have been hobbling around on their knees for months and months and months, and by that stage, everything's a lot worse.
Now, only a percentage of knee injuries actually happen in contact sports. A prime example, Amanda Zimmer was just trying to get into better shape, and she injured her knee.
Well, I was just doing some exercises and hyperextended it, and, well, as the story goes, get swelling, pain, and all that good stuff, so I decided I should probably get some help for that, so.
Did you know right away that you'd done something rather serious, or did you think, this will go away?
Took me a little bit to kind of figure out that I did something wrong, but it was pretty quick. Like, it was definitely quick, so.
So you come here to see Dr. Dale. What's he going to do for you?
Well, he'll probably do some soft tissue work for me, give me some rehab, like exercises and stuff to do, and probably, things not to do while I'm doing exercises, so.
Amanda's knee wasn't badly enough hyperextended that she needed to wear a protective brace, but had she needed one, Macdonald says that they are no longer the cumbersome contraptions they were.
No, they're really good these days. They're custom fit, and in fact, at our clinic, we measure them on 2 separate occasions. Yeah. It's that whole carpenter's rule, measure twice, cut once, so that we end up with a brace that fits really well, and they can last for years, and they're carbon fiber, titanium, super, super light, and they still allow you your normal range of motion while protecting you against anything outside of that normal range.
So if you've got a knee problem and you're unable to get the answers you feel you need through the provincial outlets, and if you're willing to pay for the service, then Calgary's Knee Clinic just might be the best way to get you back out and doing those things you love but haven't been able to do since you got hurt.